with that. I think there's also an opportunity to work together going forward to capture the best of the activism that has come out of this crisis and some of the things that have run alongside this crisis. So I would touch on the activism around the Black Lives Matters movement, the activism around holiday hunger, the activism around the Me Too movement, as all being examples of where there's been an anger and an activism created and an opportunity for trade unions and community and voluntary organisations to work closely at local level to capture that and build that into a movement of sorts at local. We talk strongly about the need for a stronger voice at work, and your sector talks strongly about the need for a stronger voice in civic society. I think they're two sides of the same coin. We talk as trade unions about welfare, defending welfare and public services. You're the people who fill the gaps that have been left by austerity, tackling the real impact of universal credit and PIP. And you're the people who have the expertise and face the lived experience every day from people who suffer the consequences of attacks on welfare and public services. We talk in trade unions about safe, satisfying and dignified work. And you every day talk about lifting families out of poverty and improving the life chances of people. Work used to be a route out of poverty. It isn't always now. And your experiences in dealing with food poverty will have seen that many people who are in work are living in absolute destitution as well. And our post-pandemic work, looking at building a class unity and a new deal for working people, I think sits right alongside your aim to build community unity through a much more participatory democracy.
So I suppose when we think about the kind of COVID-19 pandemic, it has shone a spotlight on inequalities. And I think similarly, the death of George Floyd, it's kind of increased our awareness of the impact of state violence. And I think the global awakening to structural racism is welcomed, but there's a risk that we won't achieve the change that we want to see if we don't do enough self-reflection. Something about the public health literature in particular that continues to remain silent on this agenda. And so I think it's really important for us not to hold back and to, if we really want to think about how we make that difference, I think focusing on kind of structural racism is one way of doing that because it's something that we generally haven't done historically. And then when we're thinking about racism, I think that there is, again, another risk that we get a bit sidetracked by focusing on interpersonal levels of racism. So, you know, we end up throwing resource at kind of unconscious bias training, which often provide quite simplistic explanations of power and privilege. And, you know, these training courses may help people to better visualize racial hierarchies, but it seldom tells us about how it manifests itself in our decision making, our actions, and so forth. And neither does it really give us a sense of the consequences that this might have for Black and brown bodies and other marginalized groups. So if we're really to kind of stretch our minds to understand inequalities, we really need to do this in the context of structural racism in terms of how that how it's shaped through legislation, policies, processes and resource allocation. And what we also have to be mindful of is that well-intentioned interventions can and do harm. And when we think about the sector, the breadth and depth of the impact that the sector has is variable, if we're honest. And when we also look at how resources are allocated, they're not equitable. And so when we reflect on our experiences of the pandemic, you know, funders and the government were, really kind of trying to get funding out as quickly as possible. And that kind of sort of set the tone for like this race for resource. And the challenges for a lot of Black-led and other minority-led organisations is that we are generally quite small, and we weren't able to really respond to these calls because we saw an increase in demand of our services, and we seldom have a kind of fundraising team. So what we found was that a lot of white-led organisations who did have the capacity were receiving the funding to deliver intervention on behalf, or for, Black, Asian and minority ethnic communities. But one of the difficulties with this is that they didn't necessarily have the reach into these communities, so would then approach organisations like myself, who would be asked to do the heavy lifting in order to be able to deliver on their outcomes. You need us to work with you, because today I think the sector, and I'm thinking about the voluntary sector and the public sector, have really demonstrated that they haven't been able to narrow the inequalities gap. And I think it's really important for partners to understand that we have power and agency despite the stresses that we are exposed to on a daily basis and the traumas that we are exposed to. But I think one of the issues is that the people that we try to work with, or who approached us to work with them, are very reluctant to share the power. And so what I would say is, don't assume that we don't have the capability, the capacity to lead, or the interest. But what is really important is that you use your power to enable us to do that for ourselves. So we tend to be kind of quite hyper visible or invisible in the literature. And there's also a lack of representation from the people who undertake the research. So I think, again, we really need to think about improving, remembering that this knowledge that is produced becomes truth, because that is then used to shape our policies, our practices, our processes, where resource flows. And so I'm not suggesting that we abandon the literature, but I think we need to be more critical of it, beyond how big a sample they used or what statistical technique. But we really need to think about the positionality of the people doing the research, to critique it from a cultural and a political as well as historical perspective, so that we can really understand it, again, in the context of these systems of oppression. Say that when we're thinking about structural racism, rather than remaining silent or avoiding the topic at all costs, it's so important for us to confront our racism, to be curious, and to feel compelled to learn more and do better. And approach.
You touched on is that health is absolutely a unifying area, and it's absolutely, I think it's undeniable the level of kind of movement-based approach that the Northwest has had, and thank you, Lynn, for kind of reminding us of that. And so it's a really, I think that when we think about public health, I can't imagine why we don't respond and think about public health in a movement approach, given that all of us are patients, even if not all of us are practitioners or health professionals. And so what does it mean when most of us don't shape access to public health, that most of us are actually erased and ignored, and that our bodies are not even considered when we think about what a healthy body is? And that's not just on the basis of race, but also in terms of gender, in terms of disability, in terms of chronic sickness, in terms of class. So it's really, really important that we think about what it means in this moment, where COVID is absolutely reminding and revealing that there are social and structural implications of how society is engineered, has impacts on our body. It's really important that we think about what it means in this moment, where COVID is absolutely reminding and revealing that there are social and structural implications of how society is engineered, has impacts on our body and has impacts on the quality of life that we have, and is such a profound determinant of whether we live or not. Conversations around COVID and the disproportionate deaths, it's been discussed often by the government, but also more broadly in civil society, as if Black and brown bodies are dying disproportionately in some arbitrary way, as if it's that something within our bodies is the reason that we are you know, are disproportionately dying and being impacted by COVID, as opposed to relating it to the impact of trauma, not just present day, but also generational, linking it to the histories of colonialism, of the impacts on our body, parents' bodies, on their physiology, and how we can't escape it, that the body keeps score, that the body keeps record, that what we have inherited from, you know, for example, I'm Bengali, and, you know, the British created a famine when, you know, millions of people had died in Bangladesh. And as a result, our communities experienced stunting, which is that our bodies didn't grow or malnourished. So often you see Bengali people as petite and small. And those are, you know, physiological impacts of structural and colonial and racist harms. And we're still not connecting the physiological impacts of our environments and how they're designed, but also the everyday decisions, from microaggressions to the erasure, to not believing our pain, and not believing our pain showing up as, you know, disproportionate deaths in communities of communities of color in custody, or the overrepresentation, as Mahmoud's work has shown, the overrepresentation of Black and brown bodies in mental health, but not when it comes to adequate physical health support. So while I want us to talk about trauma, the current apparatus that we have and what is available to us, because it has been led by a Eurocentric model, which is I think, therefore I am, causality and effect. So what you can see and what can be proved as the only way of verifying what a person's experiences, has completely led us to this deficit model, where we're actually inadequate to support one another. And what we need to be moving to, as Natalie mentioned, is being led by lived experience. What do people's experiences reveal about what health is, what a body is, what impacts us? But beyond that, why have we not believed those bodies? Because those bodies have already been speaking, those bodies have already been hospitalized, already been institutionalized. So what is the relationship to power and belief and trust, which brings us back to eugenics and brings us back to which bodies matter, which bodies don't, hierarchies of knowledge, colonialism, Western knowledge production, and really connecting with those aspects. And what is really profound, and when we think about these hierarchies of knowledge, and we're thinking about a COVID response and why Western knowledge production fails us so deeply, is that, as I mentioned earlier, is that it's connecting, it relies on dismembering the body, I think, therefore I am, to treat the body. And when we look at non-Eurocentric modalities of knowledge production, the body is a site of knowledge, that our genes reveal things, that our emotions reveal things, that ways and compasses by which we are informed of our environment, which we are informed of our boundaries. We move forward from that, and how do we move past a dominance of hierarchies of knowledge which have set us up to not know and to not understand, and therefore remain inadequate in supporting our societies to have the most robust health that is possible. One absolutely is being led by lived experience and centering lived experience, but in order to do that, to create the conditions and the capacity for people who are lived experience to lead, to have, as Natalie said, not to be racing for resources, but actually be able to show up, is that we do need to look at trauma. A lot of the times when we look at communities that have been harmed and marginalized, and we're not thinking about how to resource them, not just in a monetary sense, but actually create capacity for them in a day-to-day sense, in a real, material, practical way, then those people can show up with restored agency, because trauma removes agency. It makes us disassociate. It takes us away from our own lives. If people are then resourced and have the capacity, they are then able to lead and to be able to reveal and show in ways that are not extractive but equitable, and aren't re-traumatizing, and do not come at the expense of our lives and our traumas. A third part of that is embodied, that we have to start looking at embodied knowledge systems, that oppression relies on us not understanding our bodies and living in a dismembered way. And when we start connecting with our body, we are able to move from a more holistic, more informed place. And so really understanding that there is no way to move forward without having a deeper relationship to our body, which then includes our environments, the natural, our physical, our structural environments too.